Hi, I'm Teresa Devitt Lynch, a member of the AFN Board of Directors. On behalf of my fellow directors, I'd like to welcome you to the Academy of Forensic Nursing. This is an organization with an abundance of committees and activities of interest to its membership. Please visit our website, www.goafn.org, to see what's available and to get involved.
Hi, I'm Kathy Carter-Snell. I'm one of the directors on the AFN board. I'd like to introduce you to our wall of presidents. This is our past president, Diana Fagno, our current president, Kathy Rossi, and our president-elect, Jennifer Johnson. This amazing group of women have been leading us to the successful organization we've become, as well as our founding members who are listed on our website at goafn.org. The mission of AFN is to link research to practice through dissemination of scholarship, education, and service to those affected by and responding to trauma. So we're not limited to one type of trauma, we're not limited to one type of violence, and we're not limited to victims versus abusers. So it's anyone affected by or responding to trauma, and we work together. You'll see with our membership. We have our other executives, which are the Secretary, Valerie Sievers, and our Treasurer, Deb Holbrook, and our current Board of Directors, Angelia Trujillo, Trinity Ingram-Jones, Annie Lewis O'Connor, Tamara Jackson, Teresa Devitt Lynch, Christine Footlachero, myself, and Paul Clements. So in addition to that, we have a number of committee members and chairs, which I'll tell you about, and all the dynamic members that have done so much for this organization. Our membership is multidisciplinary and diverse. So you can see we have healthcare professionals, we have associate frontline professionals, students. You can apply for distinguished memberships for being a leader in your area. Distinguished fellows, Dr. Paul Clements is our first distinguished fellow, and distinguished fellow emeriti. We also have scholarships available, which have been generously offered through Virginia Lynch and a number of other sources for international members to ensure that they don't suffer undue hardship. For instance, we found out in Portugal that the membership is half of their monthly salary because their wages are so low. So we don't ever want that to be an issue with members not joining us. We have ambassadors, and we're always developing partnerships with organizations that have to do with violence and violence prevention. So we have a number of amazing partners in the community. Some of the activities that we've been up to in continuing education, it's one of our real big strengths. We have been offering weekly webinars throughout COVID. Some of them have been free, but a large number of them are for members only, so that's a huge benefit. We offer continuing education certificates, and we've been partnering with Montana to offer CEUs for our current conference. We have boot camps available on our learning management system for strangulation and elder abuse, as well as testimony, and we hope to have one coming up for male victims and abusers. I'm going to let Angelia Trujillo tell you about the LMS system, and many of you have been attending the conference that we inaugurated now in May.
Trujillo. I am Angelia Trujillo. I'm a founding board member and the Education Committee Chair. Thank you for being with us at our inaugural conference. We have really sought to highlight regional practices for both the novice and the expert forensic healthcare provider. The Education Committee is working hard to develop educational opportunities that appeal to and support the learning needs of all of our members. We have implemented a learning management system. It's called Go AFN Learn. There is a screenshot of the cover page there for you. We have successfully completed our soft launch with 3 of our boot camp trainings. So please watch for notification about our official launch of Go AFN Learn in July. These boot camps are available now through the system. So please send us an email at afn@afnmail.org if you are interested. The link to the learning management system is here, goafn.thinkific.com. And there are a few offerings that are available currently now that are free, a couple of 1-hour webinars, as well as the school nursing boot camp, and 3 other boot camps are available for purchase, and we can register you for those. So on behalf of the Education Committee, I welcome and thank you.
We have a number of committees for members to get involved with. We currently are looking for chairs for the membership in the research committee, but we have education, ethics, legislative committee, interprofessional practice, and journal and podcast committees, all extremely active, and you're welcome to join any of those. The Interprofessional Committee, I'd like to highlight with the Chair Val Sievers. It's developing practice guidelines and position statements. If the time of day or the day of the month is an issue, I thought I'd post these for you. It meets monthly on the second Monday of each month, and they're currently working on evidence-based forensic practice and trauma-informed practice. The Journal Committee, headed by Christine Footlachero, is meeting monthly as well on the third Thursday of each month. And they're alternating their meetings. One month it'll be in the daytime and one time it'll be in the nighttime. Can never find a perfect time, especially when we have international members and members all over the country. So Christine posts an article and sometimes even gets the author to attend the meeting. And we do a group critique of the session with some set guidelines that are circulated to you. So it's quite exciting to help us build our evidence base. We're strongly committed with AFN to have evidence as the basis for our practice and know the quality and the level of research behind the information that we provide.
Hi, I'm Kathy Bell. I am the chairperson of the podcast committee. Bellwork Talks was developed from a desire to engage listeners in a short time frame on topics of interest to forensic nursing. We aim to provide a wide range of topics related to our practice, and we hope that with an introduction in a short time frame through these podcasts, that we'll be able to pique an interest for individuals to want to find out more about a particular topic. Some of the things that we have presented podcasts on up to this point are nightmares, contraceptive issues and updates on different methods, gangs, pornography, animal abuse and its link to violence, missing persons, and we aim to update and add a new podcast every 2 or 3 weeks. Our podcasts are available on a variety of service providers such as Apple, Google, and Spotify. To access, you can download your preferred app, search for AFN Bellwork Talks, and begin listening. As a member, you can actually access on the website under the members section, and we look forward to having you listen to our podcast, and we would love to have feedback from anyone, and I look forward to seeing you in the future on our podcast. Thank you.
We have a number of special interest groups in addition to the committees that members are welcome to join. We have 8 of them that are currently active right now: the child maltreatment, elder, death investigation, school or public health, human trafficking, adult trauma, research, and in the international SIGS. But we're also open to the opportunities for student nursing, military, disaster, legal nurse consultants, corrections, campus sexual assault, and other opportunities such as behavioral health or other ideas that the membership would like to pursue.
The Adult Trauma Special Interest Group is a group of AFN members who are dedicated to supporting forensic nurses that provide care to survivors of trauma. And we do so by promoting evidence-based practices in that clinical field. We recently have completed a DV and IPV nursing competency. So be on the lookout in the next couple months. That will be published soon. Please visit the site goafn.org/AFN-SIGS. If you're not a member of the AFN, I strongly encourage you to go to the website and sign up today. This is a very dynamic organization and that is highly diverse and dedicated to the scholarship, service, and education in the areas of forensic healthcare. So please visit the website, www.goafn.org, and get involved.
I'm pleased to be able to chair the International Special Interest Group, or SIG. And the purpose of this is to support other countries in raising their profile, or to have countries that are ahead of us in their forensic healthcare to share their best knowledge of practices and evidence, as well as to make sure that the guidelines and research that we develop as an organization are relevant to all of our members and not just those in the United States. So anybody outside of the United States is welcome to join, although American members are welcome to sit in on our meetings and contribute at any time. The last thing I'd like to highlight is the membership section of the website. All of our members have a separate section. You have to log in to get this, so this is not freely available to everyone else. But we have a colleague cafe in there. We have general discussion section, announcements about education and training opportunities that are available, the latest position statements, whether they're finalized or seeking feedback from the members, laws and policies that are relevant to us. There's a separate site for each of the special interest groups and committees. Kathy Bell's Bell Work Talks podcasts are located there. A separate section for position statements, as well as the legislative updates. And we've got a number of activities going on. There's many things going on behind the scenes, but we are developing toolkits as well. So there's one under review right now for gunshots, and we hope to do one for injury identification and traumograms and a number of other issues going on. So lots for you to get involved with. We hope that you'll be interested in joining any of these activities with.
So AFN has a strong commitment to research and its application to safe and effective clinical forensic practice. The research committee actively works to identify potential grant opportunities and funding that not only benefits AFN, but contributes to the forensic community at large. Being primarily a practice-based profession, it is imperative that our clinical actions are evidence-based in nature as we seek justice for both victims and offenders. The various educational offerings that AFN also uses are research-based information that can immediately be translated to enhance your safe and effective clinical practice. If you have an interest in this research specific interest group, please reach out to the research committee coordinator through the general AFN email.